Okay, so you're all set here. The audio is going through the phone. So,
How many people are expected to log in online? Right now, right?
what you would do is have us plus three, but if you ever wanted to check, just come over here.
Oh, there it is. Okay. We can do whatever. I'm happy that you know what I mean? I'm flexible. If you don't mind, I would like to do like a brief introduction. I just want to know what people's majors are and what's their area of interest. So I will post that before I get in. Oh, hi.
Thank you for doing this.
Oh,
I apologize. I don't agree with this at all. I'm leaving. We appreciate you. And in fact, I've got to, we'd like to record it. And we need to get her to sign. Okay, let's start. We are already 5 minutes behind, so okay, let's start our weekly seminar. Today, our speaker is Ms. Marita Bond, who is the Director of Health and Social Services for the city of Bridgeport. Briefly, she has been the director. She leads the efforts to promote, prevent, and protect the city residents, of course. She has been in public health sector for 15 years. Her MBA is from UConn. And before this job, she was working as the executive director for Eastern Area Health Education Center. So let's welcome Ms. Bond. She is very interested to have our students working in our department in different capacities. So she will be sharing that. So let's welcome Ms. Bond. Again, she is very busy. She has a very important position. She took the time to come here. Let's welcome her.
Thank you so much. And thank you for the invitation to be able to talk a little bit about what we're doing in Bridgeport, Connecticut, and ways that we can potentially collaborate and partner. So again, my name is Marita Bond, and I get to lead the largest city in Connecticut. I oversee about 11 divisions, health and social services, from code enforcement to public health initiatives. And so today, what I'm hoping to do is just talk a little bit about what initiatives we have in place, and talk, and then have kind of like a conversation of what do you see yourself, what's your interest in ways that perhaps you can contribute in towards our departments. We have many needs. I love interns, and one of the things that I have learned from my prior role when I was a student is getting an internship or a capstone project that's going to leave me with value and something that I can use into my workforce in the future. So I'd love to hear like what your interests are. So before I even start talking, if we could just do a brief round of introductions of what's your major or a dual major, and then what's your passion in public health. So I'm going to start with you, if you don't mind.
Yeah. Hi everyone, I'm Purvi Desai, and I am pursuing Masters in Public Health, and my major is epidemiology, and I'm interested in it.
Oh, wonderful.
Yeah, hi. My name is Nisha Tanwar, and my major is also in epidemiology. And I'm also interested in epidemiology as my second master, so I want to do specialization.
Nice. I am in desperate need of EPIs. We have plenty of them.
I'm out of block and faculty, and my research is mostly in health plans.
Health plans, health insurance plans, access to care. Wonderful.
Elizabeth Lucas is my doctorate in health policy management, and my passion is corporate wellness.
My name is Hong Kim. I'm technical inbound airline. Now I'm working the lead the contamination, the health, particularly the brain and the skin. I'm also interested in the kind of the sun area because there's a lot of the sun from the industry contamination.
Yeah.
Also,
Especially in Bridgeport.
Yeah.
My name is George Contreras from Dartmouth, Policy Management. My interests are emergency preparedness, pre-hospital care.
Nice.
I am Marita Bond. I'm a doctoral student in health policy management. I work as a data analyst and my interests are data analysis.
Nice.
Hi, I'm Ken National, faculty in the Department of Public Health, Health Policy Management, primarily in the doctoral program, and I'm co-director of the Center for Long-Term Care. So I have an interest in caregiving, long-term care,
I'm Nick Mercado. I'm a first-year PhD student, health policy management. I am a medical ethicist in a major health center on Long Island, and I'm very interested in public health ethics, specifically around surveillance techniques.
Nice.
I'm Mark Fiddleson. I'm the chair of public health, and I guess my research area is technology and health.
Yeah, my name is Edwin Menson, and I'm the director of our regional health solutions
Oh, sure.
network. And second year to our PhD student, and my interest in employee regional employee.
I know all about OSHA. Oh, yeah. And quality safety. We have a quality safety meeting tomorrow with the CAO. Oh.
Hello, my name is Julie Maria. I'm in Dr. Public Health alumni and I
Okay. So,
Elizabeth Rudy, and I'm faculty in epidemiology and
oh, cardiovascular disease.
Connecticut,
You do? What part of Connecticut?
Stanford area.
Okay, that's not bad.
Familiar with Bridgeport.
Yep, yep. Yeah, so, yeah, that's two good areas. Yep. And who found me online?
My name is Jeffrey Patrick, and I am an MPH candidate, health policy and management at the present moment, and I'm really interested in closing that gap between quality and quantitative care. That's all. We'll see how it goes from there. I'm in my first year.
Yeah. Well, thank you so much. Oh, we have one more.
Hello.
Hi.
I'm Virginia Pinda. I'm a doctorate student as well in health policy and management. My interest would be looking at international healthcare systems, comparing them to the U.S.
Yeah. It's all relevant. I mean, thank you so much. I mean, it's just a vast array of interest in here. I heard policy management a lot across the board, and that's so critical when you're in public health, because if you do not have the right policies in place from the beginning, it can really impact the community in a negative way. So exciting. All right, so just to give you kind of like an overview of what I anticipate to talk to you today, is I want to distinguish the difference between public health and medicine. I'm pretty sure you're probably experts at it by now, but just to lay the foundation on that. I want to discuss and illustrate services that we offer at the Bridgeport Health Department and align them with the 10 essential public health services. Who all here know about the 10 essential public health services? Right? Most of the MPH students should be raising their hands. That is where everything is leading in public health. And so what we've been doing at the health department is really ensuring that we are aligning the 10 essential public health services with our program. So I'm going to kind of lay that out a little bit for you. And then we're going to have just an open discussion on potential collaborations between you all and my departments that I oversee to see if there's ways that we can. So this is not going to be hopefully my first visit. This can be an ongoing relationship where we can kind of come back and say, okay, these are some projects that we have in mind. But today is really to just give you kind of like a foundation of what we do, and then let you process if you can envision yourself working with the community. And so just because I love to illustrate our vision and mission, our vision is healthy people and healthy communities with equity and well-being. I'm sorry, I didn't introduce myself to the people online. That's okay. So hi, everyone online. I did not, I acknowledge that you're here. And well-being for all. And then our mission is to promote and protect the health of the people. And we do that through an array of provisions of the essential public health services, monitoring of programs, code enforcement, and implementing state and local statutes that are in place. And ultimately, collection of health information so that we can be able to determine where we need to be focusing our areas. And so when we talk about what's public health, this is Public Health 101, I think you all should know that it's what we as a society do collectively to ensure the conditions in which people can be healthy. And so public health is really an array of things. It's very broad when we talk about public health, right? Even all of you, as you introduce yourself, each of you had a specific area of focus that you want to do. And so public health can be many things. It can be a system, it's a profession, it's a method, it can be government service like I'm in, it can be an outreach to, and then it could be the health of the public. And so it can be an array of things and how we approach it. And so who benefits from public health? It keeps all people healthy and the community strong. And so these are some initiatives historically on prevention programs in the community that have been successful over the years. Immunizations for children, historically have eradicated some diseases and have reduced diseases among children. Screening people for HIV and AIDS, providing health services in rural areas to ensure access to care, protecting people from disasters and disease outbreaks that hurt emergency preparedness. We have an emergency preparedness program at our health department. Screening for newborns, promoting healthy lifestyles to reduce chronic conditions. That's actually one of our priority areas as well. And then also screenings. Right now, as you know, I'm wearing pink because I just left the beach doing a kickoff with the police department and the fire department because we're doing an awareness and outreach initiative so that we can increase not only screenings, but we want to make sure that we raise funds for further research for Breast Cancer Awareness Month. We also do things around the environment, keeping air and water in our neighborhoods clean. We respond to things all the time, complaints about air quality issues, either in a school system or in a specific neighborhood that has certain factories. And so as public health professionals, we respond to those things and may partner with DEP often to address them. We promote on-the-job health and safety, my friend over here, right? So we do quarterly safety meetings with our staff to ensure that when they're out in the field, they have the proper tools and equipment that's going to keep them safe. Or in the workplace itself, are we keeping the office area conducive to being in a healthy work environment? I have to tell you, we have one lady that is the secretary of the main city area, and she loves to spray the Bed Bath & Beyond sprays. And then I know she's in the building because I'm sneezing for like 10 minutes. And so people don't realize how sensitive the air quality is. It's not natural air in a building, right? And so it's simple things like that you have to educate employees about safety for others and and how others are allergic. So we all benefit. It's a benefit for employees. It's a benefit for the community. It's all relative to everyone. So when we look at public health and we look at medicine, traditionally, this is what public health and medicine has historically been, right? We know that public health does not really deal with individuals. When we look at public health, it's more on a population base. We're looking at impacting a larger number of people, where in medicine, you're really looking at, one person at a time to provide clinical treatment. The person comes in with a reason, or they get referred to a specialist, et cetera. So it's really individualized. They're focused on diagnosis, where we as public health professionals are really trying to do disease prevention, right? So we're trying to figure out, how do we prevent you from getting sick? How do we prevent that chronic condition from happening? And we are all about health promotion, right? Oftentimes, I'm like the social marketing queen at the health department across the state. And not that I'm trying to brag, I'm not the best health director, but the commissioner often calls me to present to my colleagues because I'm all about social marketing. how do we capitalize on social marketing and tying that in with health promotion? Because when you are teaching the people early and you talk about behavior change, it's all about catching them with the topics and doing it in a creative way. So I forgot to talk about the opioid, so I'll give you a quick example. We were doing an opioid campaign because, as you know, that is it's an epidemic across the country. The city of Bridgeport is one of the top 5. We created a campaign that we wanted to make sure that it represented our community. Our community is predominantly Hispanic and Black, with small percentages of refugees that migrate into our city. So we needed to make sure that the campaign looked like them. And so when we created a peer-to-peer video series, we really had people from the community that represents them telling their stories. And we called it the Bridgeport IMU. So rather than having this whole national campaign, we knew that there were national efforts. We really needed to localize it so that people can relate to it. And so that's social marketing. We also then decided, let's put it in the movie theaters because everybody likes to go to the movie theaters. So how do we engage them? So it's engaging the public on social media, and we're meeting them where they're at, because we can't expect people to come to us. So health promotion is so critical in public health. And then we talk about interventions. So we may place interventions to the environment and human behavior. An example of interventions that I had to do recently is that we had an air quality issue at one of the schools. And I had to come in, the public facilities, we had all these different, the principal, we all had these different players. People were getting sick. And so we had to implement a protocol in place and an intervention so that we don't have an air quality problem in the future. And so those are some interventions that as public health professionals, we may interfere with. And then we know that public health is government, or some of them are private. I have colleagues that went into public health but through the private sector where they promote, I think I heard someone say they want to go into corporate, yeah. So there is certainly public health in the corporate sector. It's just a different avenue. In government, it's a system, right? We all know when you're in government, whether it's local, state, or federal, there's a system that has been historically in place. And so it makes it a little bit more difficult in the private sector or the nonprofit sector to navigate oftentimes, and we can talk about that. In medicine, it really is focused on diagnosing the individual and giving them treatment, and the intervention is really about medical care. And then most of it is private and some of it is public, right? So we know that some of it is public, like the SQHCs, the community health centers, the walk-in clinics that, we have all these pop-up urgent care clinics that are now popping up from everywhere, and offering, you even have AmeriCare clinics now across the country that offer free services to uninsured and underinsured individuals. So that's just to kind of give you a scope of the difference between the two. And we know that when people invest into public health early on, there's a vast array of studies that shows that it is an investment and you can save lots of money. People can be healthier and live longer. And that is what we're trying to do, quality of life. And you talked about quantity versus quality, right? So how do you do that? We have to incorporate public health at the beginning and stop focusing on trying to manage the disease once they're already sick. And so it's a lot of education that has to happen. And that's why I love all the people that are in policy and management, because that is one of the things, one of my passions that I had to learn in this field. I've been in public health 18 years. I am pretty much aging myself at this moment. I look young because I'm petite, but I am dead. I have a 20-year-old in college that's like 18 minutes from here. I was like, oh, I wish I would have not had a meeting right after this. I could have had dinner with my son. But one of the things that you learn early on is advocacy and setting policies. It is so critical. Policy management is critical when we're developing public health initiatives. So to move forward, I'm going to talk a little bit about the programs and services that the health department is doing and how they align with the essential public health services. So these are the divisions that I oversee. I oversee health administration, communicable disease clinics, environmental health, housing code. Anti-blight was added to that in my transition. I was appointed as the health official almost 2 years ago in November at the health department, and I ended up taking on anti-blight as part of the housing code division, and we can talk about that. Lead poisoning and prevention, someone mentioned that that's your interest here. The Lighthouse program, so we have youth services under my division. where we do after-school programming and incorporate public health initiatives into the after-school programming. Public health preparedness, social services that incorporate an array of services from disabilities to veterans to the elderly. And then vital statistics, right? So vital statistics is so funny. This supervisor has been with the city, maybe 30 years. And she could not figure out how vital statistics related to public health. I'm like, you have the records of birth, death, marriages. You have data that we need as public health professionals. And the coolest part about my job, I have to say, is that every baby born in the city of Bridgeport, my name is on their birth certificate. That's like the coolest part of my job. And so, I often share that because it's like, how cool is that, right? Unfortunately, they're on death and marriages too, but I think it's more exciting. It's exciting when babies being born are there. And so these are the 10 essential public health. Who's seen this wheel before? If you have not seen this wheel before, you better go start researching because you're all public health professionals here. This is the route that we're going, especially because of accreditation. The 10 essential public health services here is the law in Connecticut. So it was created into a law that health departments need to ensure that we are implementing the 10 essential public health services that have to do with assessment, policy development, and assurance, everything that you all are interested in. And so the way I broke it up is that I'm going to show you how we are offering programs that fall into the 10 essential public health services, just so that you can be able to correlate the two. So the ones that I'm going to focus on right now is monitor health status, diagnose and investigate, inform, educate, and empower, and then enforce laws and regulations. So to protect the health of and so as a health director, my critical role is really under enforcement because I have staff, I have department supervisors, and then employees within those. And so my component is really assessing, enforcing, making a determination. Do I need to shut them down, not shut them down, fining, not fining, etc. So a lot of my role falls into enforcement. The lead poisoning program, we provide lead screenings to children of 6 or under. We do not deny anyone if they're older and are having concerns, but that is our focus because that's what the statutes tell us. We educate property owners and the tenants and the community members on healthy home principles. And this is actually one of my employees doing lead screenings at one of the schools. So this is actually a real house. So we have to identify and eliminate and reduce lead hazards in structures built prior to 1978. That is what the law is. And sadly, we have most of our housing stock in Bridgeport was built before 1978. So when we talk about we have a major lead problem in our city, it's significant. And we have to relocate the families that are exposed and have been poisoned with lead. So oftentimes we have a relocation enforcement officer who's a case manager who often has to work with the families to relocate them until the remediation of the house can be done. And so this is a Connecticut Post house that we had major lead issues with, and they were able to do some abatement. But we have to investigate housing complaints that are involved with insects, rodents, molds, mildew, you name it. We have to follow up. So we provide certificate of apartment occupancy. So our housing code laws are actually stronger than a lot of laws across the country. I was just at a conference in Kansas City with the National League of Cities where they brought together all of these different states, and they do not, in my mind, I thought our housing code ordinance was like really dated, and by the time I left our conference, I was recommending them to use our ordinance as a model because a lot of tenants do not have the rights as Connecticut residents, well, specifically to Bridgeport. And so we also have to educate the tenants and the owners because oftentimes we have a lot of absentee owners in the city of Bridgeport. So you have landlords in Bridgeport that just own properties, but they live everywhere else, but not in Bridgeport. And so oftentimes they're not really dedicated and committed to the community. Oh, you guys can ask questions throughout.
Do you look at
Absolutely, absolutely. And so, actually, we've been dealing with that in an elderly home. It's an elderly, in a subsidized housing state, through HUD, and it's just, 55 and over, or people, or persons with disabilities. And we just had that issue with the elevator, and we had to collaborate with the state to ensure that they fixed it in a timely fashion, because the residents couldn't even get to their respective apartments. So we have to get involved. They also had a bed bug issue. So I had to have a whole community meeting with the residents, because there was an issue with management versus the residents. And so oftentimes, as health officials, we come in and just try to mediate, or have to call people together to enforce. And then the other route is, if they do not comply to what we recommend, then they have to go to the state prosecutor, and then the state prosecutor does a different level of enforcement through the state. Which is pretty good. But you have to have the documentation, just to your question, the inspectors have to be very thorough with taking proper pictures and documenting everything, so that we can be able to protect the tenant. Or vice versa. We have had tenants that purposely are bouncing from apartment to apartment and search out apartments that are damaged, because they don't want to pay rent, and so they go through that. So we kind of, fortunately for me, when I came in, a lot of my employees have been there 15 plus years, and so they give you a background. Okay, well, this tenant is, this is the background of this tenant. So I try to make sure that that I'm not biased, and I try to remain as objective as possible. We also do food handler courses. We transitioned to a hybrid approach, where we call the residents to come in that are working, to come in and do a computer testing. And so we proctor the testing online. We educate them on environmental matters, and then we also regulate establishments to ensure that they're meeting standards. So we license anything from bodegas to nail salons to tattoo shops, tobacco shops, you name it, we license or shut them down. Not that I want to shut people down, but I've had to. Because in barbershops, sometimes you have people that are just not complying with the regulations, and we have to think about the safety of the public. And then the next group of the tenant central health services is mobilizing community partnerships, developing policies and plans, assuring a competent workforce, evaluating effectiveness and accessibility and quality of personal and population-based health services. It goes back to your point. So one of the things that I love about the tenant central public health services is that it is forcing health departments who have historically not been really held accountable to really look at, are you really complying with all of these different areas? Who knows about public health accreditation? So I am in the process of becoming accredited. So we just officially submitted it. So in the last 2 years, that has been our focus. And the focus for accreditation is not because I want the stamp of approval, like, yeah, Bridgeport's doing great. It's because I want to make sure that we're laying a foundation, because the 10 essential public health services are actually embedded into the 12 domains of public health accreditation. So it is going to, so no matter if I have to pass the baton to the next health director, once you're accredited, you have to maintain standards and measures across all your departments. So that's going to protect the public, because my vested interest is the people. And I want to make sure that, if I ever leave, that it's going to continue to be successful as a department. And so these are just examples of some community partners that we do work with. So there's a primary care action group, which consists of the 2 major hospitals, all of the health departments in the region, and we conduct community health needs assessments every 3 years as a collective. So each of us financially invest in doing focus groups, collecting data, analyzing the data, and determining what are going to be our priority areas, what does the city need, what are the gaps, and then we work with them on developing a community health improvement plan and work on several activities that I'm going to mention. So Gut Healthy Connecticut, we did our walk and talk where we go to Seaside Park at the beach, and we invite providers to volunteer for 6 weeks, and we invite people, and every week the providers are talking about different health topics to the community. It is such like a hit. So one of my strategies the way that I was successful is because I'm all about collaboration, because listen, if you don't learn anything from this presentation, the future of public health is that you have to collaborate with other agencies because the resources are very scarce. So one of the strategies, and I decided, is that for the 6 weeks, Marita was not going to be the leader of that. I'm the leader as the health department, but I designated a leader from different community agencies to lead a walk each week so that they can be empowered and invite other people from the community that will not likely come. And it was such a hit because people really gained a lot from that. We also have a farmers market to increase access to food. We have a food policy commission where we sit on there and we give recommendations on food policy issues on increasing access to healthy food, and community groups and organizations and governmental agencies as well. So this is our farmers market. This is live. This is just this past summer of individuals coming in and getting fruits and vegetables. So we facilitate that all the way into the end of October. And then how do we link people to services, and how do we research for new insights? When we first came on board, we needed to do an internal assessment. So we needed to assess the strengths and weaknesses within the department to determine what are we doing. When I came on board, there was no strategic plan in place. There was actually no vision statement, no values. All of that stuff needed to get in place so that we can have a clear direction for the department. So we had to look at what are our opportunities, what are our threats, and we had to agree on values that we felt as a collective that were important to demonstrate an organizational structure and culture. So these are just examples when we did our internal assessment. And this is, instead of doing a fancy survey monkey evaluation, we just had people express, did they feel like they liked it with sticky notes. So we had to get creative, try to keep people awake, and really make them be part of changing the language in the mission statement, adding the value. So I wanted to make sure that we were very inclusive. And then who has heard about public health performance management systems, right? That's the thing. So if you're not doing performance management as a local health official or a nonprofit public health agency, you're not doing public health. And so that was one of the things that we have to incorporate and do a performance management survey. We wanted to make sure that we were having performance standards, measurements, and reporting progress and quality improvement in place. And so we utilize tools that are already in existing. So one of the things that we wanted to make sure is that we were not reinventing the wheel, but we were using tools that have evidence-based, proven that they work. And so this is just an example, like what our managers and employees told us. They never heard of the assessment before we implemented it, and that they sometimes utilize a self-assessment report. So it was very astonishing for us is that we needed to really get the leadership team on board with performance management. And so we also did, this is just kind of like an overview of the timeline that we put into place when we were looking at the performance management system overview. So we assessed our goals, we assessed, so every year we have to establish, goals. So we assess them. Are they measurable? Did we use the SMART objectives, right? Hi, how are you? So, those are critical components, and we have to realize that across the departments, it was not consistent. So we were not having the same standard across the departments. And so the performance management system overview allowed us to develop this template so that everyone across the board, regardless of your area of specialty, are utilizing the same template. And so this is just our stakeholder dialogue. So the other component that we had to do is invite the external stakeholders to give us input about our department. So we held and hosted stakeholder dialogue. We invited city council leaders to host listening sessions in the community, and then that really posed our strategic planning process. And this is just pictures showing you how the health department really had the community dialogues and listening sessions. And this is an example of oftentimes that we need help with, because if we have facilitators to transcribe some of the information that is being collected or organizing them for us is some of the things that would be helpful for us. So this is just an example of our strategic plan. I can share with you online. We launched it. It got the mayor's stamp of approval because, as you know, our health department is in a government structure, so we needed to make sure that we were inclusive with the mayor's office because they have their own 10-year plan. So we needed to make sure that their 10-year plan and the strategic plan was going to be aligned. And then we also implemented customer satisfactory surveys. So right now we have all of these surveys, and it would be nice if we can really have them analyzed. So this is another project that would be good for someone that's interested in, like, what are the constituents saying? Are they happy with the services? So we created this survey, and now we've collected it. Now we need someone to really analyze it and just kind of put it into a format report. This is also a collection method that we did for the farmers market, doing assessments. So we have assessments, but now we need them to be analyzed. So here we are collecting all of this information, but we really are not putting them in analyzing the data in a way that can be really informing the public about anything, or even informing potential funders. And so we also looked at the community health needs assessment and it revealed that there were evidence-based solutions on physical activities, that there was a need for it because it was going to reduce the risk of type 2 diabetes and high blood pressure to prevent weight gain. So we decided to create an initiative based on the Community Health Needs Assessment report and create a Take the Stairs Initiative challenge. So what we did is that we met with the Civil Service Commission, and we wanted to make it inclusive for the employees. We have over 3,000 employees within the city of Bridgeport, and we wanted the employees to also take part of Taking the Stairs Initiative. So that needed to go through an internal process of approval so that we can even have postings up. So all of those logistical pieces, when you're trying to develop programs, is something you want to be thinking about, because you got to think about, okay, you can have a phenomenal idea of something you want to work on, but you have to think about who are the players that I need at the table that's going to help bring this project into implementation mode. Because if you're not inclusive from the beginning, your project will then just flop. Or you have to ensure that if someone else is already doing it in the community, that you're not duplicating the efforts. And so one of the things that we have to identify is, okay, we have these 10 essential public health services. I want to establish a strategic plan, but I don't want to do something that a nonprofit is doing well or another corporate organization is doing well. So how do I engage them so that I can demonstrate that we're linking the people, but not necessarily offering it? So public health departments don't necessarily need to be doing the actual work. We have to be partnering and being able to say, yes, we can link the people to those services, because then that's how you're being more cost effective with the resources that you do have. So the Take the Stairs Challenge was very successful. The evaluation was conducted to ensure that we use the stages of change theory. And so we wanted to make sure that we use evidence-based, and 91%, almost 92% believe that the success challenge motivated them. We were able to get incentives. I mean, people were just really into it because it was something to do, and we did it during the winter, because in the winter is really when people are kind of like feeling like they don't really have a place to go. And so this is just an example of the steps that people took and our promotional efforts. So one of the things that in public health, historically, we are always behind the scenes. And when I first started public health, we were always the people in the background, helping agencies push issues forward, saving them from crisis, and never getting any recognition. And so one of the things that I have done is say, no, we have to brand ourselves. If you guys come to the health department, maybe hopefully one day you guys can do a tour, you will see health department logo, everything health, even my rugs have the health department logo. Because I want you to know that you are in a health department, everything health department, even to the campaign that we do, everything has to be inclusive, and we're at the forefront. And I love utilizing the media. We invite the media everywhere. I'm gonna be on Channel 12 tonight, rolling all night long, but you know what? We have to be able to do that. So public speaking is essential in your field, whereas 18 years ago, it was not. So some of my older colleagues who have been doing public health for 20, 30 years don't feel comfortable with public speaking. So when we come together as regional health directors, they throw me in the front because I don't have a fear of speaking. However, they have to realize you run your own respective cities and you should be at the forefront, ready to speak to media. So if you have not taken any communication courses on public speaking, I'm urging you to do that because that's the avenue that public health is going. Because if we continue to be in the back, we are going to lose funding and they're not going to include us. These are just examples of the social marketing campaigns that I mentioned. I am all about fight the bite, fight the flu, fight something. We're going to fight. And so I do billboards. I mean, people, when I tell you these are everywhere in the city, they are everywhere. I just spoke at several churches on Sunday talking about fight the flu. And I gave him, very brief talking points. You need 2 minutes or less because you're going to lose their attention. And my youth tell me we love stories. So one of the things that I have to learn with my youth because I have to present to a whole bunch of middle school kids in 2 weeks, they want stories. So, and I have a teenager, so they don't want to hear too much of a lecture. Well, as adults, we can tolerate them a little bit. And so the health department hosted a re-imaging retreat. So what did I do? Because when you're in a government system, you have to figure out, how do I navigate the politics? Let me tell you all something. No one, and I got my bachelor's in public health, my graduate in public health with a leadership MPA certificate. Not any course told me that when I became the health director, I had to fight with the politics. So I'm gonna let you all know right now, if you wanna be a health director or if you wanna work in the government system, you have to navigate through the politics, because if you do not, you will not be successful as a leader. So what did I have to do? I had a crash course in politics in the city of Bridgeport. Is it bad? No. Thankfully, I'm an urban city girl by trade, so I'm a fighter and I'm petite and I'm feisty. So I'm usually ready, with my dukes up, but it's draining. So what did I have to do? I had to get strategic. How do I engage the mayor's administration to buy into public health? And that's what the strategy, so what did I do? I said to the communications department, let's do campaigns where the mayor can come in, he can say a few words. And so what did I have to do? I have to be inclusive. So it can make the mayor look good, I look good, I still get my message across. At the end of the day, it's population health. Is the population going to hear what I need them to hear? So it's not always about me being at the forefront. If it's the mayor at the forefront. And the good thing about my mayor is that he will say, our health director, he'll give recognition to the health director, which is great. So that is the strategy where I see the downfall of the government system, where sometimes people fail, is because if you're not inclusive with the administration and what their vision is, you can't push your public health issues. And so that's one of the things that I started doing, is I included the communications department to re-image and include the mayor's vision with our vision. And so it's a win-win. And so the retreat also included the staff, because the staff did not even know, because like I mentioned, they were there for decades. So here you guys are all learning all the new trends. They don't know the new trends. So I had to come in and teach them. They didn't realize how the 10 essential public health services aligned with their day-to-day work. So we did a whole activity around, who knows about the Wizard of Oz? I hired a consultant who happens to be also my personal friend. And we did a whole retreat on teaching them about the 10 essential public health services with Dorothy. And she comes in dressed as Dorothy with red shoes and everything, okay? And then we did the boarding of the plane, where we then went into activities. But we have to get creative, because you have learners that have not been in school for so long and have been in public health for so long. So I had to get creative on how we were going to do that. And then we did, and so we did several retreats to ensure that the staff were going to be engaged. And so somewhat knowledgeable, this is the Essential Health Services. So we realized we really need to, this is post the training. So they felt somewhat knowledgeable. prior to the training, they had no knowledge. And so we know that it's going to be an ongoing workforce development. And what else do we do? And this is our clinic. We provide tuberculosis clinics. Our clinic is one of the few clinics in our entire county that's actually offering TB clinics. So a lot of the surrounding cities rely on our city to provide care to their patients. And then we have a full-service STD clinic that's offered several days a week. And then we also provide vaccinations for international travel in schools. We also, and I forgot to add here, we also do the surveillance piece. So if there's a food outbreak, we have to respond to that as well. And oftentimes, when the food surveillance issue is greater than like 20, the state and the local partner together to address the issue. And so this is just some of the health department team. We gathered together during National Public Health Week. We usually do activities every single day. We include policy. And the other suggestion is know who your local legislators are, know who your city council members are, and who your state reps are, and become friends with them. Because what we did is I did a legislative roundtable, and they love to shine, and it makes them look good, and I have a roundtable, and then we get to discuss our issues. So it's a win-win for everyone. So I had a legislative policy day on the last day to talk about opioid and the opioid crisis, and Blumenthal even made it to that event. So that is our team. And so just to kind of wrap up, what I'm hoping that we can do as some collaborative efforts together is that I'm hoping that we can do some research and compile maybe some clinical data, some vital statistics data, or other health-related data that can aid with program development and evaluation. Hopefully, perhaps you'll be interested in maybe attending public health-related events to promote health-related topics throughout the city, or intern with a respective department that you, oh look, my sentence got cut off, that fosters your interest. That's what I was going to say. That fosters your interest and your passion, because you want to be passionate about what you want to do. So for me, when I placed an intern, only because when I did my undergrad, I did an internship and they had me doing secretarial work. And I would never, ever forget that horrible experience. And I said, if I ever become a healthcare or an executive, I would never have an intern go through that process, because we are learning theory and you want to be able to apply a lot of these theories that you have learned. And so for me, when you come to the health department, we sit down and we develop a work plan, and you literally follow the work plan, because when you leave with a whole product. So I'll give you an example. I had a UConn student that lived in Stanford but went to UConn at Stores, and she wanted to do her internship with us, and she was interested in water issues. And so she put together a water forum. I gave her a work plan, I gave her the key contacts, and then I guided her through the process to make sure that she was going to be successful. And she ended up putting together a successful community water forum to educate the people about the quality of water in the city of Bridgeport, because there was a water plan that was just published in Connecticut, and they were seeking community input for that. And I ended up giving her a proclamation for that, because although I was excited because I wanted the project done, but she got the credit because she's the one that really implemented it. So I had a vision and she implemented it. It was a win-win for the student and a win-win for me. So that kind of wraps up my presentation. This is my contact information, my tagline everywhere I go. If you ever hear me speaking somewhere, promote, prevent, and protect. Follow me on Twitter at Marita Bond, MPH. I'm not a real social media, I just do Twitter. Because I like following all the public health junkies are on Twitter. I'm not really on Facebook, but hopefully this was informative, and I want to thank you for your attention. And I'm going to open it up for any questions that you may have.
Hi. I'm Amy Ansell. I work here at New York Medical College, and one of my many functions is to direct the practice program for the NPH students. So first, I want to say that your presentation, and unfortunately, I had to come late. There was something else I had to do, but it was awesome. And I walked in just as you were talking about
Yes.
And that they really are the basis of making sure you have a really viable product.
That's right.
Project.
That's right.
What you said about products is really clear. Our students will be doing portfolios, they have to have products, they have to have fact sheets, posters, practicum reports. We had a wonderful practicum experience with you a number of years ago. One of our